Today we're getting under the hood with Dr. Nicole Christian-Brathwaite, a mother, daughter, sister, women's advocate, and a double board certified adult and child and adolescent psychiatrist, nationally recognized for her expertise in perinatal and postpartum mental health, trauma-informed care, telepsychiatry, mental health in communities of color, school psychiatry, and racism in healthcare. Dr. Christian-Brathwaite completed her adult and child psychiatric training at Massachusetts General and Mclean Hospital, where she led the organization of minority residents and fellows and conducted extensive behavioral health research in West Africa. She is currently the medical director of child and adolescent psychiatry at Monte, Nido, Walden Eating Disorder Hospital, and she is the CEO and founder of Wells Mind Psychiatry and Consulting Company. Wow, welcome, Dr. Nicole.
Thank you so much for having me.
Oh, I'm so delighted. It's season 4, Women's March for Mental Wellness, and your story is just going to be one that the audience will love. So if it's okay, let's get going.
Yeah, absolutely.
Awesome. So I love this question, and I ask it in every single interview, but I think it's a good one, which is, what was that moment, that pivotal moment, that inflection point that got you on the journey and into mental health and wellness?
That's a great question. I don't know if there was a singular moment. I have been very fortunate to have exposure to different populations, different groups. Very early in my life, the first few years of my life, my mother and I were homeless. And through that experience, my mom actually created a nonprofit with other homeless individuals, an organization that still operates in Philadelphia today called Dignity Housing. And so during that time, I essentially watched my mom build something from scratch. And Dignity Housing essentially supported mothers and families who were unhoused or homeless, but not just providing them housing, but education, and were advocates and helping them even just understand different systems. And so during those years, I was at the shelters with my mom. I'm witnessing the trauma that children had to experience when they were unhoused. And so even then, as a child, I always knew I wanted to work with children. I wasn't sure in what capacity, but I watched and, even certainly had my own experiences where I'm like, kids need help. They need someone that they can trust. And I fortunately had a wonderful family and a wonderful grandmother who literally never said no to me, gave me everything I could possibly want. And so I also recognize the benefit of having that unconditional love and having that support, while also witnessing a lot of the children and families that my mother worked with did not have that support. So, going into college, I knew I wanted to do something with kids. I wasn't sure. I majored in psychology and nutrition. I was leaning towards the mental health side. And then I actually ended up taking a year off after college, which is a whole other story. I ended up contracting tuberculosis during time away, and I had to take time off. And so during that year, I worked at a program that provided essentially educators to local schools in Philadelphia. And so I was basically the health teacher for elementary, middle, and high school in West Philadelphia and North Philadelphia. And that was for me when it really clicked, because when I'm working with these kids, sure, there were medical illnesses, but I realized the kids who were really struggling were the ones that had trauma or that had mental illness or that had significant behavioral problems and were being labeled as bad, but no one was asking why or what's behind these problems. And so that was when I made the decision that I'm going to go into behavioral health. I'm going to go into psychiatry. I want to understand the why, hopefully work to support kids and families so they're not just labeled and discarded.
Wow, there's so much to unpack there. My heart is just like so heavy, and so happy at the same time because here you were in the very situation that you were witnessing, and you're sitting here thinking about the other kids versus self, which is pretty magnificent for such a young person to be that, have that kind of empathy and care. So I'm sitting here thinking about that, but then also what unfolded and that moment of putting the puzzle pieces together in teaching and seeing that it's just incredible that you saw the fact that these kids are being labeled almost unjustly. And so you wanted to do something about that. So, what did that look like? I mean, after having that experience teaching the kids in lower school and seeing the disconnect, if you will, what was Nicole's journey like from then on?
And I had incredible mentors, and I began doing research in juvenile detention centers. And that's certainly when I began to be more interested in trauma, because I was screening these kids for illness, and 80 to 90% of the kids that we met with who were in a juvenile detention center met criteria for at least one mental illness. And, whether it was depression, anxiety, ADHD, but then underlying all of that, there was profound trauma, prior trauma, and even, current trauma being 12 and in, a secure institution or juvenile detention center, having to deal with mistreatment from peers and, the adults in their lives having been let down essentially by most of the adults in their lives. So through my time in medical school, I continued to do more research looking at mental health and behavioral health. And then I came to Boston for my adult and child psychiatry training at Mass General. And again, incredibly fortunate to have wonderful mentors who really helped to guide me. And during my time, my 6 years at Mass General, I became more interested in global health and, realizing that if I truly want to be able to help a broader population, I have to understand a broader population. My narrow worldview can certainly be limiting. So I did a lot of work in Ghana and Liberia and actually partnering with traditional healers. Like, how do you see mental illness? How do you support patients who have experienced trauma? And at the time when I was in Liberia, it was after their civil war, and many people had suffered unspeakable trauma and lost limbs. And so we were walking basically into a post-war society with trauma that I couldn't even, in my worst nightmare, couldn't imagine. But watching these incredibly resilient people find ways to support each other and support themselves. And so that's kind of where the journey continued. My interest in postpartum mental health actually came from my own personal journey. After having miscarriages and struggling with fertility, I finally had my first son, who was this beautiful, chubby, almost 10-pound baby of just like deliciousness. And then I suffered from profound postpartum depression to the point where I almost attempted suicide. I was a psychiatry fellow at one of the best hospitals in the world, and I couldn't find support. I couldn't find someone who would help me. I couldn't even identify what I was suffering from and with, because in my mind, I'm like, I should be grateful, right? Like this is what I've wanted. I finally have it. But postpartum depression almost crushed my joy, crushed everything. And so when it got to the point of actually having suicidal thoughts, I finally sought treatment. And then I realized more people need to talk about this. More people, more women and birthing people need to understand that postpartum depression is the most common complication of childbirth, but no one ever talks about it. No one deals with it. And so I kind of expanded my interest and my clinical care to working with pregnant and postpartum people, just recognizing that the support that they need doesn't exist.
Wow, wow. I'm just thinking I want to go back a little. I'm going to pay homage to everything you just shared. And I just want to say it's not even applaud. I so admire the work you've done, like seeing those unmet needs and wanting to fill them. That is a lot to carry. There's a great book called The Giver, and he absorbs everything in the community. How did you do that? I mean, you're in med school, you're doing your training, you're going into these countries, post-war societies that are the level of trauma. I mean, to have the capacity for that. Can you share a little bit about how you have that?
That's another great question. It's still something I struggle with because I'm an empath. So like when people hurt, I hurt. And so it's very hard to sometimes not internalize. And I certainly believe I've experienced a level of vicarious trauma, but for me, it's critical to have a purpose. Again, learning from my mother, her entire life was dedicated to activism, dedicated to speaking for people who couldn't speak for themselves. And so it almost felt inevitable. I don't know how to do anything else. I feel so strongly when I see, excuse me, I see vulnerable people being hurt or marginalized and not having the opportunities. I've had to have mentors because I need to be reminded to take a step back sometimes. I have a wonderful husband. We just celebrated 14 years of marriage. He also has to remind me, like, you have to take care of yourself too. You have to prioritize yourself. I need those reminders. I need the village to kind of to keep me in line. But I have to feel like what I'm doing matters, and I have to feel like I'm working towards something. I don't. The work is hard. It's always very difficult. So there always has to be a why that keeps you moving forward.
I think it's really important to your point to give voice to it. And I think, interestingly, women are also a marginalized community. Now, some of them might be the worried, well, they might be more privileged, but they are marginalized. And I'm kind of curious, as you look at communities that are like more from a socioeconomic background, more struggles and more marginalization versus like women, would you say, how do you from a professional and just on a personal level because you're navigating both worlds, right? What is that like for you?
It's interesting. They're even speaking, specifically around a woman who's delivering or giving birth. There are studies showing that African American professional women with advanced degrees still have poorer birthing outcomes than white women with an eighth grade or less education. And so,
It's sickening.
in many situations, your social economic standing or status, your income, the number of degrees are protective. Black women in particular, it's not. You still have to fight to get the care that you need and deserve. And that, that can certainly be challenging and sometimes almost demoralizing.
Horrible when you hear stories like that. So it's horrible to hear it as an outsider, but to live it, to your point of, here you are, a psychiatrist dealing with other people's problems, and then you're on the other side. And guess what? Finding out we're human too. What was
Yeah,
what was
absolutely.
it like for you, Nicole?
I mean, it was a shock. I thought I'm walking and I'm a physician. I understand what should happen and what it should look like, but I can honestly say, even in my training and, working in great hospitals, I was not really exposed to women's mental health or perinatal or postpartum. And so even in this setting, it very much felt like perinatal postpartum mental health was othered. So, it wasn't something it's optional or it's not, part of the mainstream teaching and studying and training. And so one, I was frustrated that I didn't know, that I couldn't recognize the signs in myself. Two, I was frustrated, like why didn't people tell me? When I ended up talking to friends and family later, my mom is like, oh yeah, I suffered horrible postpartum depression with you. Or talking to one of my best friends, she's like, oh, I was too ashamed to tell you, but I was barely able to function the first 6 months after giving birth to my son. And I'm just like, why didn't we talk about this? Like, why am I just now finding out after
Oh,
I suffered? And then just sad. I'm sad because I'm like, I figured it out because I have the experience, because I have a car and I had the ability to drive 45 minutes to find a therapist who would support me. I had the ability and time to ask around and make those phone calls. I had good insurance that would, allow me to see someone where I didn't have to pay hundreds of dollars out of pocket. So the first thing I thought is, well, what if I didn't have
mm.
these resources? What if I didn't have these privileges? Where would I be? And again, suicide is a huge risk of postpartum depression, and Black women continue to die of all causes at greater rates than their white peers. And so I feel very fortunate, and I recognize how fortunate I am, which is why I've become such a strong advocate for awareness and coverage of postpartum depression.
And so it's Women's Health Month. It's also Mental Health Awareness Month. It's so important to be sharing these stories, to let shame go. Mom, let shame go. Tell your story because you're going to help the next woman. It's almost like you have this social responsibility because by sharing your story, we'll get that next woman into the therapist, psychiatrist sooner. And so, and I can't imagine sitting there with that. But you know what the thing is about depression? When you're there, even if you've been to, even if you're a double board certified psychiatrist, you don't see it because you're depressed. You're not functioning. So I'm kind of curious to talk to me about like what are you seeing and like how is your practice available to people and who are the patients you're seeing and how's it going?
I will say, and I think my worldview is slightly more narrow. I live in Massachusetts, and I've worked really closely with some of our elected officials. One of our Congresswomen, Liz Miranda, was really a leader in bringing forth a bill in Massachusetts to ensure that there's more coverage for perinatal and postpartum. You're able to get a doula. You're able to get that support and mental health care is covered. Still going through the process of funding, but recognizing and participating in that process of assuring that there's a population level change that's happening, and more birthing centers are coming up where women of color and Black women in particular can feel safe, because a lot of Black women know the statistics and they don't feel safe in hospitals and they're afraid to go to hospitals. But without the appropriate care, then that leads to additional consequences and morbidity and mortality. And so being in this setting and being a part of a community that feels so strongly and has been able to push forth change is, I'm incredibly grateful. So my goal is to always work on an individual level, but also to acknowledge and work on a population and community level. And so I feel very fortunate to be in community and be partnered with individuals who have the power to do these things. I certainly do a lot of speaking engagements, both in the community, at my church. I just did a series of talks on fibromyalgia and menopause, other conversations that just don't come up. And women are, ashamed to talk about like sex, peri or menopausal. We should have these conversations. It's not something to be ashamed of. It's something that happens. And so, using my voice, using my experience and expertise to share with the community and translate this information so that it's palatable and the community can understand it. And then certainly seeing patients. I have a very small private practice that's primarily comprised of perinatal or postpartum women, and then children or adolescents who have experienced trauma. And my full-time job, as I mentioned, I'm medical director at an eating disorder facility, and that seems, like a very different population, but 85 to 90% of the children and young adults I work with have profound trauma. And so a lot of my role is addressing the trauma that ultimately led to the eating disorder, and helping these young people realize that it's not just trying to control the eating, it's trying to address the trauma.
I'm curious, like how would you say, Nicole, that you are marching for mental wellness? And I asked this question on an individual. It could be you and your business, it could be everything in your life. How do you do that?
Again, being a voice, it is so important to me that people feel seen and heard, but that also people are seen and heard. Sometimes my husband is like, do you have to post so much on social media? Do you have to have such a strong voice? And I'm like, I do, right? I do, because there's so many people who can't. I advocate for my patients, when we're running against, insurance is not covering this medication, or insurance is not willing to provide additional days in the hospital when we know that this person needs it. And so even the day-to-day fighting back, against, payers or insurance companies, or helping people find outpatient clinicians or providers who are willing to work with more complex patients, and advocating for them. That's how I feel like I'm personally doing it. I always feel like I should be doing more and could be doing more, but I think the other thing I'm also doing is prioritizing my own wellness, because I recognize that I can't be useful and helpful if I'm falling apart. And so sometimes I do have to take a step back, because one day, one week, one month of pulling back a little bit won't make a difference, but a year of me being out of commission because I'm so profoundly depressed will make a huge difference.
But when it comes to mental health, it's really about addressing the foundational problems, not just putting, I mean, no disrespect to medication. I think medication's amazing when necessary, but you still have to go in and treat the underlying cause, right? And so
Yes.
kind of curious building on that. I mean, you see so many different things. I'm curious as to your thoughts of, you mentioned a little while ago that you go in and you realize with these, you said it with the kids in when you were in medical school and did, what were they in juvenile?
Yes. Mhm.
You said that they have this trauma that occurs both there and what have you, but the lack of disability. Can you describe like what you, because I think that's an interesting thing that's probably able to be applied across the continuum of care that you're doing?
I don't know if people realize that they've been traumatized. And so one intervention that I always start with is just education. And so when I'm working with people or screening for trauma, I don't just ask, about physical or sexual abuse. I ask, have you experienced really negative events or, things that were so overwhelming that it felt difficult to cope? And for people of color, I ask about racial trauma because it is so important to be able to label and put language to experiences, because how do you treat something you don't even know you have? How do you address something that you don't realize is actually traumatic? There's so many people who have gone through horrible things, but they think it's normal because they know other people who have also gone through horrible things. Just because an entire community is witness to community violence doesn't mean that every individual hasn't been traumatized. It doesn't make it right because it's normalized. And so that often is the first thing I do, is to just be able to identify and say, like, you've been hurt, and that hurt or that pain ultimately turned into post-traumatic stress disorder, turned into a situation in which you began to engage in these activities or utilize these substances, or develop this anxiety disorder to cope with this awful toxic stress or this awful toxic experience. And that experience that happened when you were 8 or 16 or 20, it is still impacting you. And there's nothing to be ashamed of.
So you're here today, and I want to address this. I mean, you're doing all this amazing work, so much going on in every aspect of your life. But it's interesting as a psychiatrist, the weight of that, of taking on individuals and communities and trying to affect just a mentally healthy, it's not so simple, right?
I'm human. I have my own personal struggles, that obviously impact my ability to care for other people, impact, my understanding of psychiatry. As we were discussing earlier, I'm a caretaker for my mother who is recovering from her third bout of cancer. I have two beautiful, boisterous, loud, stinky little boys, that are 8 and 10. My oldest struggles with ADHD. My youngest struggles with significant anxiety. They always say doctors are the worst patients, so I have to. It's hard for me to take my own advice sometimes, and not blame myself for things that are out of my control, or not take on that mom guilt or that daughter guilt for not being able to be there 24/7 or fix what I see as a problem. But again, I am so fortunate to have a village that will very quickly remind me of my limitations, and that I am human, and that I do need help, and that there's certain things that I can't control.
Like when you're dealing with mental health challenges in individuals and communities, there is a subtext in that and a weight in that that's very different than going and teaching English, if you will. Not that you won't see kids with behavioral challenges, but you get what I'm saying. And so
Mhm.
take that on. What do you do for Nicole?
I do try to be intentional about how I spend my free time, who I spend my free time with, who I invite into my space. I always tell my husband, I don't watch the news. I'll read it, but I don't watch it because it is stressful, and I need to relax. I need to decompress, and so I watch very silly TV shows like The Office and Modern Family, and like the sillier the better, because I it's like an opportunity to escape. And it's also a reminder, sometimes you need to see that there's good in this world. Sometimes you need to be reminded that, recovery happens, or there's joy, or there's happiness. One of the things I do with my patients, in the hospital, every day after we meet, I tell them a joke. And sometimes it's like the silliest jokes ever. Like today, my joke was, what's the coldest letter of the alphabet? And it's B, because it's next to the AC. And like, it's like, just the dumbest thing. And
Fun.
most of my patients are like, that is the worst like dad joke ever. But I want to remind them that like this is not all you are. This illness doesn't define you. There's life outside of this. There's joy outside of this. And as silly and stupid as that may be, we have to remind ourselves that this I'm working towards something. I'm working for something. There's a light at the end of the tunnel. And I read sci-fi books and romance books and just opportunities to escape. I spend time with my kids, just doing silly things or playing video games or playing board games because I need to make sure that I have those moments of joy because when things are really difficult, I need to be able to bring those things back and hold on to those memories.
I can relate to that and the notion of decompressing. I mean, it's really important to have that space. And in particular with the kind of work you do. It's real and raw versus light. I just want to acknowledge that and say, it's the work you're doing is incredible. It must be really rewarding to see change. And how is that, by the way? Is change incremental for you?
Yeah, it certainly varies. It depends where people are in their journey of recovery, how ready they are to go into recovery and acknowledge the challenges that they're experiencing. Again, going back to being able to acknowledge they've been hurt, to acknowledge that they may have a mental illness and there's nothing, to be ashamed of, and seeking treatment is not weakness. Seeking treatment is strength. But I wouldn't do this if I didn't believe people could get better. I wouldn't do this if I didn't believe what I'm doing is actually helpful. And, there's a term that we always say, relapse is a part of recovery for every aspect of mental health and behavioral health. So for many people, you may have a depressive episode at one point in your life and you don't have one again for 20 years. But you had great 20 years of remission, or, I have women who I've supported them through their first child, and a couple of years later, they're going to come back and they're planning pregnancy, and they're like, you know what, let's be proactive and start this process now. But I truly believe in what I do, and I believe in the healing powers of even relationships. And I think one of the most important things about being a behavioral health clinician is the ability to sit with someone else's pain and be able to sit beside them and with them in that. Because for a lot of people, that's unbearable, but that's our job, that's our role, and that's a gift, that's a privilege.
Well, it's interesting that you say that's a gift and a privilege. You're saying it from the clinician side, which is just beautiful. And I think it's a gift and a privilege from the patient side to have people like you. And of course, not all psychiatrists are like you, but I mean, I think it's amazing. You started the conversation with, I knew I had to live a life of purpose. So I want you to define what that purpose looks like now and in the future, and then we'll close out.
I don't know if it will change that much. I think now my purpose is I mean, it boils down to being helpful, being able to impact meaningful change. And again, as I mentioned, day to day, it may be on an individual level. Because again, although it may be individual, this one child, this one person that I've helped will then tell someone else, or that child may become a doctor one day and use their own experiences to inform how they treat other patients. Because I've been a patient, I recognize how difficult it is, and I recognize how vulnerable you feel, and so that I bring a certain level of respect to the work that I do because this is hard. Like it is hard to seek treatment. It is hard to open up and essentially expose yourself to another individual and trust that they'll be able to support you and catch you and help you. I'm hoping in the future I can continue to grow in my leadership and be in a position where I can affect change on a much larger level, be in a position where I'm at a company where I can say, we need to focus on supporting vulnerable populations and actually have the power to change that and be able to influence the resources. That's my goal, is to be able to truly look back and say, I've been helpful. My existence has made a difference.
Well, clearly your existence has made a difference, is making a difference, and making a meaningful difference. Mental health this is not a light space. This is heavy, it's weighty, it's a lot. I could talk to you forever. A fascinating conversation, but more importantly, really important work that you're doing. So I just want to say thank you for that. Thank you from everybody to you, Nicole. This is your platform today. I mean, we're going to close out to give a message to women of all ages, of all backgrounds, of all cultures. What do you want to leave them with, Nicole?
I mean, one, I would say like you deserve treatment, you deserve care, you deserve to be supported and loved. The second thing I would just say is please prioritize yourself. And it is so hard because often women are in the position of being the caretaker, whether it's, the strong friend or the strong family member, or that, that child that's holding on to all the responsibility. And it's so hard for us to set those limits. And one of my old supervisors used to tell me limits are loving. And so by setting limits, you're actually helping the people around you. And the other thing I always say to my patients and when I'm giving talks is no is a complete sentence. Doesn't require anything beyond that. And it's hard to say no. You can say no because, or, if you want to add more, but you don't have to. You don't owe anyone an explanation as to why you're prioritizing yourself.
Love that. That is brilliant. I love all of those messages for women because it is about prioritizing yourself. It is about, and I think you made the comment, I wish everybody could have a therapist. What I never got to was, and you ended it beautifully, was creating that safe space to have these really vulnerable conversations, which are how we get healthy. So I just want to ask you one other question, which is how, if people want to reach you, how can you be reached?
Sure. So I have not been as busy on social media recently, but my handle on Facebook, Instagram is Dr. Nicole CB. So DrNicolecB. Certainly, you can message me on any of those platforms. I'm also on LinkedIn. My full name, Dr. Nicole Christian-Brathwaite. I will certainly respond questions or requests, and feel free to message me through any of those.
Awesome. Thank you so much for getting under the hood with me. And again, thank you for the amazing work you're doing.
Thank you so much.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.